হ্যালো স্টুডেন্ট, আজ পড়ব টার্গেট হাই বইয়ের ইটিং ডিসঅর্ডারের এমসিকিউ। আগে পড়েছি ইটিং ডিসঅর্ডারের থিওরি ভিডিও। ফার্স্ট কোশ্চেন, হুইচ অফ দ্য ফলোয়িং ইজ এ ক্যারেক্টারাইজড অফ অ্যান অ্যাডোলেসেন্ট উইথ বুলিমা নার্ভাসা? অপশান সি হবে এক্সেসিভ স্ট্রেন টিথ। নেক্সট, নার্স ইজ কেয়ারিং ফর এ ক্লায়েন্ট diagnosis with bulimia nervosa. The most appropriate initial goal for a client diagnosis with bulimia nervosa is option B হবে identify anxiety causing situation. Next, intratracheal anorexia nervosa is associated with cardiac dysrhythm resulting to cardiac arrest. Next, nurse is developing a plan of care for a female client with anorexia nervosa. Which actions should the nurse include in the plan? Option B হবে set up a strict eating plan for the client. Next, morbid fear of becoming obese with a persistent lack of appetite and severe weight loss is option A হবে anorexia nervosa. Next, among the following group of sign and symptom, identify the most specific sign and symptom that would be used for diagnosis of anorexia nervosa. Option B হবে excessive weight loss, amenorrhea and abdominal distension. Next, while communicating to a client who is admitted in psychiatric ward because of the disorder thinking process about food being poisoned, which of the following techniques need to be adopted by the nurse to encourage the client to have dinner? Option B হবে using open-ended question and silence. Next, which of the following part control eating behavior? Option A হবে hypothalamus. Next, which is the characterized of anorexia nervosa? Option A আর বি হবে obese with weight loss and body image disturbance, অর্থাৎ অপশান ডি হবে both A and B. Next, an adolescent with a diagnosis of bulimia nervosa is likely to exhibit option A হবে affective instability. Next, a patient with anorexia nervosa show sign of malnutrition during initial refeeding. The nurse carefully assess the patient for option D হবে. Next, anorexia nervosa is characterized by all excepted option D alopecia. Next, a young lady is present with a repeated episode of overeating followed by bargaining using laxatives. She probably suffering for option A হবে bulimia nervosa. Next, all of the following are sign of anorexia nervosa excepted option C হবে frequent eating behavior. The most appropriate initial goal for an adolescent patient with bulimia is to identify anxiety causing situation. Next, which of the following is the highest priority for a 18 years old female patient diagnosis with anorexia nervosa? Option C হবে the patient will establish adequate nutritional intake. Next, an 18 years old female patient diagnosis with anorexia nervosa tell the nurse, I have what I see at mirror, I look so ugly and fat. Which of the following strategy by a nurse is appropriate to deal with distraught perception of the patient? Option B হবে provide objective data feedback about patient weight. Next, which of the following is a type of eating disorder? Anorexia nervosa. Next, characterized of a client with anorexia nervosa include all of the following excepted option D হবে. Next, bulimia nervosa is a type of eating disorder. Next, characterized of a client with bulimia nervosa include all of the following excepted option B হবে. Next, carving and eating of non-edible substance such as chalk and mud is known as পিকা অর্থাৎ অপশান বি. নেক্সট, অ্যানোরেক্সিয়া নার্ভাসা ইজ অ্যান ইটিং ডিসঅর্ডার ক্যারেক্টারাইজড বাই অল এক্সেপ্টেড অপশান এ হবে। নেক্সট, মিসেস কবিতা এ ফিমেল পেশেন্ট গট অ্যাডমিটেড টু সাইকাট্রিক ওয়ার্ড with the complication of intense fear of becoming obese. This fear does not decrease even if the person lose weight grossly and become very thin. The body weight is 15% below the standard weight. Identify the diagnosis of the patient. Option A হবে anorexia nervosa. Next, which of the following is one of the clinical manifestation of bulimia nervosa? Option C, repeated bouts of overeating and self-induced vomiting. Next, a patient with eating disorder is being admitted in a psychiatric unit. Patient has been diagnosed an anorexia nervosa and is on treatment. The psychiatric nurse is aware that the short-term management for his condition is to option B হবে achieve a weight gain. তাকে অ্যাচিভ করতে হবে ওয়েট গেইন প্রত্যেক সপ্তাহে 0.5 থেকে 1 কেজি। নেক্সট, এ পেশেন্ট ইজ ব্রড বাই রিলেটিভস to psychiatric OPD. After detailed investigation, patient is diagnosed as an anorexia nervosa. Which of the following manifestation require hospitalization of the patient? Option C হবে blood pressure of 84/55 mmHg. Next, Mrs. Modhu is a postgraduate history student, highly concerned of her overweight. Assessment revealed that her BMI is normal. She is presently having weight phobia, features of dread of fatness and a drive for thinnings. Which of the following is the probable diagnosis? Option D, eating disorder. আশা করি আজকের ভিডিওতে তোমরা ইটিং ডিসঅর্ডারের এমসিকিউগুলো বুঝতে পেরেছো। ওকে, থ্যাংক ইউ সো মাচ।